Observers have long said Russian President Vladimir Putin likes to be first. And now CNN has learned that Russia says it intends to be first in the world to approve a coronavirus vaccine. Moscow says it could come in less than 2 weeks. It insists it's even got a plan to mass produce it in September. Russia is calling this its Sputnik moment, referring to the 1950s space race. The Soviet Union stole a march on the United States. So, of course, what people want to know now is, will the vaccine be safe and effective? So far, Russia hasn't released a syllable of scientific research. Well, Brazil's health ministry says a vaccine could be ready before the new year. Officials expect the experimental Oxford-AstraZeneca vaccine to be distributed by the end of December if it is proven to be safe. Meanwhile, a new survey shows nearly half of Brazilian doctors have felt pressure to prescribe unproven medicine for COVID-19 treatment. These health workers also say that misinformation over drugs like hydroxychloroquine have interfered with fighting the virus. Well, if you recall, the Brazilian president himself has been promoting that drug from the very beginning of the pandemic. Let's discuss all of this with CNN's Nick Payton-Walsh, joining us live from the Brazilian capital. And you have been speaking to Brazilian doctors. What have they been telling you, Nick?
Well, the survey you refer to pretty much fits a picture of increasing concern here about what the consistent promotion of hydroxychloroquine. I should stress that study after study has shown pretty much any stage in which it's delivered has no medical benefits. In fact, some studies suggest it may even be harmful. The kind of myth around it here, promoted by President Jair Bolsonaro, who even held it in his hand when he declared to the world he just tested negative for coronavirus after 2 weeks infected with the disease. The concern amongst some, about 60+% of the doctors surveyed in Sao Paulo, one of the megacity hotspots really of this disease, is that it's distracting people from thinking about the severity of the disease here, the serious things they have to do to help themselves. That's in fact echoed by a former US Surgeon General speaking to CNN yesterday. It's a distraction. The survey also showed that about 50% of them felt pressure to give hydroxychloroquine or other drugs that are part of the complex being offered here or recommended here by Brazilian health officials that don't really have any proven medical effects. Now, it's of course one thing to say to people, well, try this drug, it may possibly assist you down the line. It's another one to do so when there is no actual proof of any medical benefit from that. And it's a further problem when, in fact, some of these drugs may possibly have links to side effects that are harmful. So concern certainly here in Brazil, where the cases are staggeringly tens of thousands a day, 40,000 in the last 24-hour count that we heard. And at the end of last week, 50,000 cases reported pretty much every 24 hours for a 3-day stretch. The concern is that this promotion of a cure that isn't a cure, that is frankly false hope, is stopping people from focusing on masks, keeping their hands clean, social distancing, the things that might actually slow the spread, Becky.
Nick's in Brazil for you. Thank you, Nick. We are talking coronavirus here, and what we can expect to hear and see next. The COVID outbreak in Mexico is one of the worst in the world, with the country now confirming more than 400,000 infections. The numbers aren't nearly as bad as the neighboring US, but more and more Mexicans crossing the border, hoping for a healthcare system which is better equipped to fight the pandemic. CNN's Matt Rivers with this report.
Among those waiting outside public hospitals in Tijuana, Mexico, death is a constant companion. Diana Lopez didn't get a chance to say goodbye to her father-in-law before COVID-19 took him. She says, imagine a family member suddenly gets hospitalized and you just never see them again. Tijuana and its state of Baja California are among Mexico's hardest hit regions. For months, healthcare workers have told us about overwhelmed hospitals plagued by a lack of supplies. Roughly 20% of those diagnosed here with COVID have died. This nurse says we were not prepared for the magnitude of what was and is the pandemic.
Tijuana sits just across that border there from the U.S. state of California. And though it's closed to all non-essential travel, if you're legally allowed to be in the U.S., be it as a citizen, permanent resident, or otherwise, you can still cross, and if you want to, seek treatment at a U.S. hospital.
which is exactly what Dr. Patricia Gonzalez Zuniga did when her husband got the virus. The couple are dual U.S.-Mexico citizens but live in Tijuana, where Dr. Gonzalez Zuniga has worked for decades treating the city's poor. She says the public health system is broken, so when her husband got really sick, going to the U.S. for care was an easy choice.
It's like a decision of a stay and maybe, 50% chance that you will die or just go and get services.
At nearby Scripps Mercy Hospital in Chula Vista, California, we learn her story isn't unique. The hospital has been at or near capacity for months, in part because of patients from across the border. In July alone, it has admitted more than 50 COVID patients who recently came from Mexico. The hospital says the vast majority of patients who've traveled from Mexico test positive.
It does create stress in the system, and we have to deal with it.
Dr. Jose Manuel Tovar says at its peak, 50% of all COVID patients at the hospital had been south of the border, though the number has gone down as new cases in Baja California have slowed. But cases in California have spiked recently, so his fear is if the same happens in Mexico, a tough situation could get even worse. But he says this is the border. Everything is shared: culture, commerce, and COVID care.
This is one region. I have no qualms about seeing patients from Mexico.
Dr. Gonzalez Zuniga, for one, is extremely grateful for that fact. Her husband spent 14 days in a California ICU, nearly intubated several times, but he lived.
What do you think would have happened if he was in a public hospital in Mexico?
He wouldn't be with me now. He will be dead.
She calls herself lucky, and compared to the Lopez family, she is. They couldn't get care in the U.S. Maybe we could have gotten him better care over there, more opportunity. But now, after her father-in-law's death, that is nothing more than a hypothetical question. Matt Rivers, CNN, Tijuana, Mexico.
Well, the tech titans will be taking the hot seat in U.S. Congress next hour. Meanwhile, Turkey clamping down on top social media players. More on its sweeping new set of regulations just ahead.
The federal government has agreed to withdraw federal officers from Portland. They have acted, the governor says, as an occupying force and brought violence. Starting tomorrow, she says, all Customs and Border Protection and ICE officers will leave downtown Portland. It's the top of the hour. Hello to our viewers in the United States and around the world. I'm John King in Washington. Thank you for sharing your day with us. A very serious warning today about the number of Americans who may die from coronavirus. And yet, some less than serious recommendations from the president that defy medical science. America's medical leaders say multiple hundreds of thousands could die in this country if the United States continues its coronavirus fight without a national plan. But the president today indicating he's not in the mood to rethink his push for schools to reopen, to keep the economy open. And again, he's arguing against his own doctors and medical evidence from clinical trials. The president today saying he's a believer, recommending the use of hydroxychloroquine. He says he's a believer this morning, and he says the drug saves lives. The science, the trials, the evidence says that's simply not true. There are some positives, though, if you look at the data. A decline in the average number of new cases when measured against last week. We'll break down the numbers in just a moment. The United States still recording, though, 64,000 plus new infections per day over the last week. In July alone, 1,660,000 plus cases added to the case count. The United States near a lock. You see the numbers there to pass 150,000 coronavirus deaths today. The virus has killed 1,200 people, 1,244 people just on Tuesday. That's the most since the end of May. In July, 21,000 Americans lost their life to the virus. Let's get straight to the White House and CNN's Caitlin Collins. Caitlin, interesting to see the president today. Interesting, my word. I could use other words. Once again, pushing hydroxychloroquine. Yesterday saying much of the country is corona-free. Not true.
Yeah, and also defending that doctor that he retweeted when yesterday he seemed not aware of the claims that woman had made prior to that, comments about saying that medicine uses alien DNA, that doctors are trying to come up with a vaccine to make you immune from becoming religious, things like that we discussed with the president yesterday. But now that even that he is aware of those things, she said, John, we asked the president if he stood by those claims, if he regretted retweeting what he had earlier in the day, and this is what he said this morning.
He was making a statement about hydroxychloroquine with other doctors that swear by it. They think it's great. I happen to be a believer in hydroxy. I used it. I had no problem. I happen to be a believer. Many people agree with me.
And John, the president was saying there he could not understand why that video featuring that doctor was removed from social media sites, including YouTube, Twitter, and Facebook, which, of course, they said they removed it because of misinformation, like the woman that the president called an impressive doctor, saying that there is a cure for COVID-19, which, of course, we and all the medical experts and the people suffering from coronavirus know that is certainly not the case. And we should also note that that group of doctors that the woman was featured in the video with did meet with the vice president this week, though that woman at the forefront, the one who has made the controversial, bizarre claims in the past, was not at that meeting, we are told. But the vice president's office has not explained why they did hold that meeting.
Well, that's an explanation we shall wait for. Caitlin Collins live for us at the White House. Caitlin, appreciate the reporting there. Let's take a look at some of the hot spots. Again, the map improving to some degree. Let's start there with the state trends. You see 50 states. And what you see here, as you see, yes, 22 states. That's the orange and the red heading up, meaning more cases this week than last week. If you were with us a week, 10 days ago, at times we were talking about 38 states heading up. So this map is definitely an improvement. 18 states, that's the beige, holding steady. 10 states going down, notably including Texas and Arizona. They have been parts of the drive of the big summer surge. Florida and California holding steady. Their case count have been the drive in the big summer surge. So the map looks a little bit better. Well, let's just walk through some of the timeline here of the peak in the cases. If you go back to April, 34,000 cases a day, you see, right? 34, 36 here. Then you have this plateau, and then it is July, where it has just become 61, 77. But Tuesday, 61, down from the July 16th, 77. The question is, have we hit a plateau? Can we push it down a bit? These, if you talk to the White House Coronavirus Task Force, were hotspot states that Dr. Deborah Birx now says are beginning to improve. We just showed you the trends on the state map. Florida, Texas, Arizona, California. They have been driving the big case count numbers. They have also been driving the hospitalization numbers. They are improving, according to the data at the moment. Let's hope that continues. But Dr. Birx also says you have some red zone states to watch, and you see there are many: Virginia, Georgia, Tennessee, Mississippi, Oklahoma, Indiana, and Idaho. Smaller states for the most part, but still states you want to watch as you go through all this. Let's come back to the state trend map here, and you see in the middle the dark red. That means your case count this week is 50% higher than last week. This is the state of Missouri right here. In the city of St. Louis, danger of becoming a hot spot if it doesn't get its cases under control. That is the word from. You see the daily high for new COVID-19 cases yesterday. That's the 9th time this month in the state of Missouri. The White House Task Force coordinator warning St. Louis, along with 10 other cities, to get more aggressive to stop the spread of the virus. With me now, Dr. Frederick Eccles. He's the director of the St. Louis Health Department. What is it that you think you need to do, sir? And are you on the same page as the White House? We have seen in some cases the White House puts cities on a list. We touch base with the cities, and they say they haven't told us.
Absolutely, it's a great point. So early on, we had a conversation with the White House, and a lot of the mitigation strategies that they were recommending we already had in place. For example, ensuring there were face covering requirements for all citizens in the city of St. Louis, as well as social distancing requirements. And so a lot of those mitigation strategies were already implemented. However, this week we are stepping up and requiring additional enforcements for businesses that are not complying with those requirements.
And what is your biggest problem at the moment? Is it people just getting lazy, if you will, dropping down their guard as the economy reopens? You say business not complying with the requirement. What did you see as the case count goes up? What's the biggest issue?
Well, the issue right now is the population that's being impacted by COVID-19. Early on, we identified our most vulnerable populations, which are the elderly and those individuals who have underlying medical conditions. Right now, we're seeing the younger populations becoming impacted. So between June 28th and July 27th, approximately 64% of all of our cases were under the age of 40. And so a lot of these individuals don't have underlying medical conditions. They develop very few symptoms, if any, and so they can underestimate the seriousness of COVID-19 infection. And so we're really doing a better job, a more effective job of trying to reach those individuals so that we can continue to slow the spread and further protect not only our public health system, but also our hospital systems and our most vulnerable communities, particularly the elderly who live in congregate living settings.
We're at the end of July, about to move into August, which means many parents, interesting summer vacation season anyway, now having to have conversations about whether their kids can go back to school. I want you to listen here to the view of Dr. Anthony Fauci.
In many respects, unfortunately, though this may sound a little scary and harsh, I don't mean it to be that way, is that you're going to be actually part of the experiment of the learning curve of what we need to know.
It does sound a little harsh. I get Dr. Fauci's point. If kids go back to school, we will learn what happens. Where are you in the city of St. Louis? And walk through the challenge, because you're one of the many urban areas where everybody wants children back in the classroom. You look at the public health risks, you might think keep them home. You look at food disparities and health disparities, you think, oh, it might be better to have them at the school. How are you wrestling with this?
So it's a very complex situation, particularly in the city of St. Louis, where we have approximately 25% or a little bit more greater than that of individuals living at or below the federal poverty level. In addition to that, we have individuals who may still have some level of illiteracy, and so it's a very complicated situation that we're trying to navigate through. But we have to make sure that quality education is available for everyone. In addition to making sure resources are available for our most vulnerable population, one of the requirements that we made for all schools in the city of St. Louis is that they have an infection control plan, so that in the event
in the fall.
This is CNN.
To the big global coronavirus developments now, including an exponential spike in cases in India. Today, it hit a grim milestone, 1.5 million cases. The numbers are especially troubling when you consider this. It took 6 months to get to the 1 million mark, and then just 12 days to add 500,000 more new cases. More of the global headlines now from our international correspondents.
Here in Russia, officials are calling it a Sputnik moment, a technological leap like the launch into space of the first satellites by the Soviet Union. Russian officials telling CNN they intend to approve the first coronavirus vaccine by August the 10th. So soon, apparently because scientists here say they're using tried and tested technology, but also, critics say, because of the enormous pressure that's been put on labs by the Kremlin to get across the vaccine line, and conventions on human trials being ignored. Russian officials say crucial third phase trials, for instance, will take place while the vaccine is actually being administered to high-risk groups like frontline medical staff. Of course, it's risky, fueling skepticism about the effectiveness and the safety of this Russian vaccine. But given the acute coronavirus problem in Russia, which has the 4th highest number of coronavirus infections in the world, it's a risk the authorities here say they're willing to take. Matthew Chance, CNN, Moscow.
Here in the UK, there are concerns that a vaccine for COVID-19 may not give lifetime immunity. The chair for the UK government's vaccine task force, Katie Bingham, was speaking to the Financial Times when she said she thinks it's unlikely there'll be a so-called silver bullet vaccine. Instead, she says it's more likely scientists will develop a vaccine, but it may only give 1 year of immunity and require boosters each year that follows. She also said it's possible that a vaccine will simply mitigate the symptoms of COVID-19 and reduce the risk of death. Meanwhile, the UK government today announced a new deal to secure up to 60 million doses of a vaccine that is being developed by GlaxoSmithKline in partnership with Sanofi. In total, the UK government has now signed deals with 4 different vaccine candidates, potentially giving it access to 250 million doses if, of course, these vaccine candidates are successful in their human trials. Anna Stewart, CNN.
Here in Asia, the number of new COVID-19 infections is rising. And while the numbers are pretty small compared to other places, they are big cause for concern for governments here. In China, they saw their biggest daily spike in active cases since April. 101 infections reported. Most of them spread within the community, as opposed to April, when a lot of them were coming in from the outside. Now, keep in mind, China has 1.4 billion people, so the numbers are still very small by comparison to other places. Here in Hong Kong, 118 new cases. It's the 8th day that they've broken 100. 7 million people living in this densely populated city, but the chief executive warning that the city is possibly on the verge of a large-scale community outbreak if they don't get this thing under control. That's why we have the strictest social distancing measures Hong Kong has seen so far this pandemic. Also, Japan, 981 new cases, another record daily high for them. There are also new cases reported at U.S. military bases, the majority in Okinawa. Japan, if it stays on trend here, they could hit 33,000 total cases as soon as tomorrow. Will Ripley, CNN, Hong Kong.
Here in Tijuana, Mexico, this is a part of the country that really felt the effects of this outbreak before many other parts. We've been speaking to doctors and nurses inside of public hospitals like this one for months who have said at times their hospitals have come close to collapsing. And that is the reason that several people we've spoken to recently said they didn't get care